Good morning.
Good morning.
First, I'd like to thank the incredible leadership here today. Organizations that are on the ground doing critical work to save lives are being awarded our first gun violence prevention and reduction grants. Dan Katowski, President and Chief Executive Officer of Kids Above All, whose organization is also hosting us today. Thank you, Dan. He's an old friend, actually, from gun violence days. Patrick Brosnan, Executive Director, Brighton Park Neighborhood Council. Tal Hasak Laurie, Executive Director of Friends of Children for Chicago. Bob Jackson, Executive Director of Roseland Ceasefire. And from St. Anthony Hospital, Dr. Janessa Sheltz. I'd also like to thank and recognize our Cook County leadership, Avik Das, who's Director of our Justice Advisory Council, and Bill Laurie. Commissioner Bill Laurie, my commissioner. And I also like to thank David Jones, who's our sign language interpreter this morning. We're in the midst of a gun violence epidemic. In 2016, the American Medical Association declared gun violence a public health crisis, which we in Cook County did subsequently as well. Since 2016, we've only seen the issue intensify, especially during the COVID-19 pandemic. In 2020, there were over 45,000 gun deaths in the United States. Last year, Cook County experienced over 1,000 gun-related homicides. June is Gun Violence Awareness Month. Since the beginning of the month, we've been discussing the scale of gun violence epidemic and the systemic factors that contribute to the problem. Today, we're here to talk about solutions and the action we are taking to end this epidemic that has claimed and damaged so many lives. In response to this epidemic, the Cook County Justice Advisory Council, the JAC, has led the development of a new grant program funded by the American Rescue Plan Act. That's the federal resources that came to us for recovery. These gun violence prevention and reduction grants will bring $65 million in funding over 3 years to our city and suburban communities most impacted by the gun violence. Through our Justice Advisory Council, Cook County has funded community-based violence prevention programs for almost a decade, since 2013. Now the American Rescue Plan Act enables us to invest more funding than ever in these vital evidence-based programs. This is the level of investment that is needed to confront the surge in gun violence that we're experiencing. This level of funding will help spur lasting change in our communities that have suffered as a result of this epidemic. Last week, the Cook County Board of Commissioners approved the first 5 gun violence prevention and reduction grant awards. Today, we acknowledge the recipients of these awards: Brighton Park Neighborhood Council, Friends of the Children, Chicago, Kids Above All, the Roseland Ceasefire Project, and St. Anthony Hospital. These organizations serve different community areas in our city and suburbs. They work with different populations and utilize different strategies for supporting at-risk youth and adults. But these organizations share a common commitment to providing holistic support to at-risk residents. The innovative and quality programs they have proposed for this initiative will positively impact many individuals, families, and entire communities. And this is just the beginning. Today, we announced the first of $14 million in funding, but later this summer, we will announce additional grants totaling $65 million, investing in programs that prevent and reduce gun violence. In addition to funding these life-saving services, Cook County is leveraging American Rescue Plan Act funding to make complementary investments designed to stimulate economic growth and bring financial stability to our families and communities which have suffered due to historic disinvestment. The Cook County Promise, our guaranteed income program, will begin accepting applications in the fall. We're providing reentry housing support for justice-involved individuals to ensure their stability and success as they transition back to their communities. We're abolishing medical debt for low-income residents and providing legal aid for housing issues such as eviction and debt. We're investing in long-term behavioral health expansion through the Cook County Department of Public Health. These investments will provide financial relief and stability for individuals, families, and communities in need of resources. These investments will come alongside our investment in gun violence prevention to address the root causes of crime and violence. This long-term, holistic approach is how we will build communities that are safe and thriving, the type of communities that all of our residents deserve. Now I'd like to bring up Avik Das, Director of the Cook County Justice Advisory Council, who will moderate the rest of this press conference. Thank you, Avik.
Good morning, everyone.
Good morning, Avik.
All right, thank you. Thank you, President Preckwinkle. It is an honor to be here today to celebrate this announcement with the partner organizations who have been awarded grants and our county commissioners who represent many of the districts that will be served by these programs. I'm going to share some additional details about the Cook County Gun Violence Prevention and Reduction Grant Program, and then I'll introduce our commissioners speak here in the 3rd District and the partner organizations who will briefly discuss their mission and approach to violence prevention. The Justice Advisory Council, JAC, has been focused on rising to meet one of the most critical challenges we face as a county, addressing community violence and sustainably increasing community safety. We have worked closely with the Office of the President to design the American Rescue Plan Act funded Cook County Gun Violence Prevention and Reduction Grant Program. We are so proud of how this initiative is taking shape. It sets high standards for programming and reporting. It also welcomes applicant organizations of different sizes, offering diverse services that meet the unique needs of the at-risk populations and the neighborhoods they serve. We embrace the holistic, people-centered approaches to violence prevention that we know are extremely impactful for individuals and their communities. This work has not taken place in a vacuum. For really the past year, Cook County leadership has met regularly with partners from the City of Chicago, State of Illinois, including the Illinois Criminal Justice Information Authority and the new Illinois Office of Firearm Violence Prevention. This intergovernmental, collaborative violence prevention working group has focused on coordinating the timing, geographic areas of focus, and metrics for violence prevention funding opportunities. This collaboration has strengthened our programming and will help maximize the impact of this critical and unprecedented funding. Participation in this $65 million first-round ARPA-funded opportunity is also unprecedented. Almost 400 organizations were represented in the 190 applications received by the Justice Advisory Council. A total of almost $500 million in funding was requested. This volume highlights the breadth and scope of the organizations poised to advance gun violence prevention and reduction work in our county. We are excited to be partnering with the service providers here today, as well as the many other grant award recipients who will be announced later this summer as we progress further with our application reviews. And so before we move to hear from our different awardees, I would love to yield the mic to our Commissioner of the 3rd District, Bill Laurie.
So Avik, first of all, I want to just say thank you to you for your leadership in the very good work that you provide to all of us here in Cook County each and every day. We appreciate you. I am Bill Laurie, Cook County Commissioner of the 3rd District, and I welcome all of you to the 3rd District. Pursuant to my joint committee meeting ordinance last December, I then brought a resolution before our county board in January requesting that there be a joint committee meeting between the Health and Hospitals Committee, chaired by Commissioner Dennis Deere, and the Criminal Justice Committee, chaired by Commissioner Stanley Moore. And we convened that joint committee meeting so we could discuss the county-wide strategies to combat the recent surge in violent crimes, and specifically gun-related crimes and carjacking. This resolution was followed by a public meeting in February where all 9 of the Cook County departments which engage in anti-violent strategies, they reported on 3 things. The anti-violent strategy which the department was implementing, the anti-violent strategies which were being implemented in collaboration with other departments at Cook County, and all the departments addressed the resources which were needed from the Board of Commissioners to more effectively implement the anti-violence strategies of the department. During the public meeting, we heard from the following departments. We heard from the sheriff, the state's attorney, the public defender, the clerk of the circuit court, the chief judge, emergency management and regional security, Cook County Health, Cook County Department of Public Health, and the Justice Advisory Council. Following that historic meeting, President Preckwinkle and the Board of Commissioners, as well as the Justice Advisory Council, launched the Anti-Gun Violence Grant Fund with $65 million of our ARPA resources. These grants range from $150,000 to $18 million, and they will support the anti-gun violence efforts of organizations in suburban Cook County, as well as here in Chicago. As a lifelong resident of Cook County, I believe this board has one job, and that job is to take on the challenges of today as we work together to ensure a better tomorrow. So, our better tomorrow starts today. To all of you, be safe, be healthy, and be blessed. Thank you.
Thank you so much, Commissioner Laurie. So as was noted earlier, these first 5 awardees include very compelling programs in diverse areas of Chicago and suburban Cook County. The services they will provide to residents will save lives and strengthen our communities. So it's my pleasure to introduce a representative from each organization who will talk a bit more about how these grants advance their vital work. First, I invite Patrick Brosnan, Executive Director of the Brighton Park Neighborhood Council. This grant supports their work as a lead organization, partnered with 3 other organizations as well. Together, they deliver an array of behavioral health and wellness services combined with mentoring and workforce development support to youth and young adults. Patrick?
Thank you all. My name is Patrick Brosnan, and I'm the Executive Director of the Brighton Park Neighborhood Council. We're a community-based organization serving the southwest side of Chicago, primarily the 60632 zip code. We have been partnered with JAC for years, providing school-based interventions and workforce development opportunities for low-income and for individuals that are justice involved or that have experienced violence. And this partnership is just an incredible opportunity to solidify the amazing work that they've already been supporting and that the county has already been supporting in the southwest side. We have brought together gun violence, specifically gun violence, has an enormous impact on all sides of the community, on all facets of the community. And so in order to address gun violence, we really need to bring all of our partners together, the entire community together, and really address the trauma that young people, especially young people in our community, are faced with as a result of gun violence. So in that goal, we have brought together New Life to expand their really phenomenal street-level intervention programs for young adults and young people. Centro Sanar, which is a outpatient clinical counseling agency that's going to be providing clinical services for families impacted by gun violence in the southwest side. Brighton Park Neighborhood Council is going to expand our school-based interventions for young people who've been impacted by violence of all kinds, but especially gun violence. And that includes victims and people who have been, who maybe are gang involved. We need to address all sides of this community. And then Polaire, which is our workforce partner, because we can't address gun violence unless we also are addressing the root causes of poverty. So we need to bring all of our community together, and that's what I think we're achieving in this proposal. So I want to thank Director Das for his incredible leadership and support. Obviously, I want to thank Commissioner Laurie and our Commissioner Alma Anaya for the incredible support and trust that you have in our community, and obviously President Preckwinkle for your continued leadership on this issue. Together, we're gonna address gun violence. Thank you so much.
Thank you. So next, I welcome Tal Hasak Lowy, Executive Director of Friends of the Children Chicago. This organization's unique long-term model for mentoring, no matter what, from early childhood to young adulthood, is transformational and comprehensive. As friends, they are committed to accompanying youth and their families with individualized support and outreach in school and community environments, ensuring they are not alone in facing significant trauma and other challenging circumstances. Tal?
Thank you. Hi, my name is Tal Hazak-Lowy, and I'm the Executive Director of Friends of the Children Chicago. I'm proud to be part of a county pursuing a multi-pronged approach to end gun violence. If you ever talk to someone who's engaged in gun violence, most often you'll learn that they were exposed to significant trauma when they were a child, and their parents or caregivers had significant struggles themselves. Without sustained support to buffer that impact, we cannot be surprised if a child exposed to trauma grows up to engage in violence. I'm grateful that the Justice Advisory Council and county commissioners believe that no one is destined to engage in gun violence. We share a belief that if we provide a child with proper support, they'll stay on a positive trajectory. At Friends of the Children, we do outreach and intentionally identify the 5-year-olds facing the greatest obstacles. And we provide each child with a consistent, positive relationship they can count on. We help each child develop the relationship skills and goals they need to overcome hardship and ultimately thrive. There's no quick fix to the profound struggles and barriers faced by the children and families we serve. That's why we commit to staying by their side for 12+ years, no matter what. Our full-time, highly trained, salaried professional mentors spend 4 hours a week individually with each child and are involved in every facet of that child's life: school, home, and the community. We also work in close partnership with the child's parents and caregivers, connecting them to resources, strengthening their parenting skills, and empowering them to advocate for themselves and their children. It's this level of in-depth, long-term support that can make a world of difference in the life of a child. As part of a national network with 30 years of experience, we know our model works. 92% of youth go on to enroll in post-secondary education, enlist to the military, or enter full-time employment. Friends of the Children Chicago has been serving children and families on the west side for the past 4 years, and we are thrilled that the Cook County Commissioners and Justice Advisory Council are making it possible for us to expand our program to start serving children and families living in the south side communities of Auburn Gresham, Englewood, Roseland, and West Englewood. The difference this investment will make for our youth and city is immeasurable. Thank you very much.
Thank you. Well, let's hear from our host. Dan Katowski is the president and chief executive officer for this host organization, Kids Above All, Illinois. Their name certainly says so much. Their broad array of services ultimately centers the support of children and young adults and their families, with a strong focus on addressing trauma and meeting unmet behavioral health needs through a variety of program models. Thank you for sharing the space with us so that we can celebrate this. Let's hear from you, Dan.
Thank you, Avik. Thank you so much for your leadership and support. Thank you, President Preckwinkle. President Preckwinkle has been toiling in the vineyard of doing her best to reduce gun violence for years, and I'm proud to know her and we're grateful for all of her support. I want to thank Commissioner Bill Laurie for all of his leadership and all of his advocacy and all of his support. I wanted to highlight our leaders and our team. We have Jerry Laureano, who's our Chief Clinical Operating Officer. We have Plachette Ham, who's Director of Foster Care. Kim Young, Vice President of Programs. Andre Tyler, Head of Becoming Me. And Patrice Eberhardt with Becoming Me as well. So please give them a round of applause. At Kids Above All, we place the safety, well-being, and education of all children above everything else so they can build better lives. Priority number one is to make sure they have every opportunity to realize their full potential in life. And that means doing whatever we can to protect them from gun violence, whatever we can. And what I'm so grateful for and appreciative of the fact is that President Preckwinkle and the county board recognize and understands the importance that gun violence is a trauma that needs to be addressed immediately. It is one thing to remove very dangerous, excessively dangerous weapons out of the hands of children. It is one thing. It's another thing to make sure that young people have every opportunity to have jobs, to have the best quality of life. It's another thing to address the trauma that they face. Because as Tal talked about, this trauma that young people are impacted by, they will be carrying it with them for the rest of their lives. So what this grant is going to allow us to do is to make sure young people get the therapy and the support they need so they can begin to heal. They can get the mentors that they should have in their life, the support that they have, the one-on-one interaction, the support groups they should have, so they have a chance to feel like they're getting the connections with the people who really, truly care about them and want them to no longer have to deal with this trauma. So to have that kind of support and to have that validation. And the fact is, because if we do this, if we address this right away, we're going to address depression, we're going to address isolation. We're going to make sure that we're going to address suicide in the future. We're going to make sure that young people have every opportunity to have a productive and quality life. That's what Kids Above All is all about, and that's what this grant is all about. So we're so grateful for the chance to make sure that we can connect our young people with every single level program, as well as their parents. Because as Commissioner Laurie said, it starts today. And it's a multifaceted approach, and we're very, very grateful and appreciative to have that chance. Thank you very much.
Thank you, Dan. Very exciting. Next up is Bob Jackson, Executive Director of the Roseland Ceasefire Project. This organization is expanding its boots-on-the-ground violence prevention teams, focused on reaching out to young people ages 18 to 29, engaged in behavior involving guns, including exposure to gun violence or periods of incarceration for gun-related activity. With this support, Roseland Ceasefire substantially expands their intensive one-on-one and group engagement to center on helping historically marginalized and underserved communities. Bob.
Good afternoon. Roseland Ceasefire is truly, truly honored to be among these distinguished anti-crime fighters and community groups. It is our pleasure to be part of this team to help reduce violence in our communities throughout the county of Cook. We're also, Roseland Ceasefire will be focusing on the far south side and the far south suburban area of Cook County. It is our goal to address this one block at a time, to get to meet and get to work with every family that's being impacted by gun violence in whatever shape or form, along with domestic violence. We have reached out to kids as young as 7 to 72 years of age to work with them regarding trauma and their families, how to reduce the violence in the community. Because all of our work on the field do not mean anything if the family is not accepting this program, understanding what we're trying to do to help them and to alleviate the pain and suffering through gun violence. So once again, I'd like to thank the Cook County Board, Madam President, Commissioner Laurie, and all the commissioners, especially our commissioner in the 5th District, Commissioner Deborah Sims. Thank you.
Did I lose my spot? Here we go. Last but certainly not least, we're going to hear from Dr. Janessa Sheltz-Brown, Senior Director of Community Development at St. Anthony Hospital. This long-standing institution includes hospital and clinical-based services, often starting with contact in the emergency room due to trauma experienced by victims of gun violence. Participants can count on holistic care and access to targeted mental health services and individualized case management and victim services. Doctor.
Good afternoon. My name is Dr. Janessa Sheltz-Brown. I'm the Senior Director of Community Development at St. Anthony Hospital. On behalf of St. Anthony Hospital, I want to start by thanking President Preckwinkle, the Cook County Commissioners, and the Justice Advisory Council for their commitment to addressing gun violence in our communities. We are honored to have this partnership to expand our work on the west and southwest sides of Chicago in communities like North Lawndale, Little Village, Brighton Park, Back of the Yards, East and West Garfield Park. We are honored to have this partnership to expand the services, and it is St. Anthony Hospital's mission to promote health for all community members, and we have been doing this for over 125 years. Over the past 25 years, St. Anthony Hospital has been providing free services such as case management, mental health, and access to health care through our community wellness program. The grant monies received from the Cook County Justice Advisory Council will allow St. Anthony Hospital to enhance our current work, strive towards our vision of improving overall health of our communities. Additional therapists, crisis workers, and care coordinators hired through this program will increase access to high-quality, trauma-informed inpatient and outpatient services. This will also allow St. Anthony Hospital to increase wraparound service support, positively impacting our communities for years to come. Once again, we are honored to have this partnership, and thank you for your ongoing commitment to support to our communities.
Okay, we'll take questions from reporters on the line. I know we have Block Club Chicago on. Do you want to go first?
Organizations received their funds.
I'm sorry, could you repeat your question, please?
I'm sorry, how soon will these organizations be able to receive the funding?
The question is, how soon will the organizations begin to receive the funding?
We are now in the process of developing all the final agreements, and we're expecting the entire cohort to be up and running by September 1st.
And again, these are 3-year commitments to these organizations, okay? So we're getting the contract documents in order.
Anything else?
No, that'll be all. Thank you.
Thank you.
All right, do we have any other reporters on the line? Going once?
Hey, Sadie Quick from the Chicago Tribune.
I'm sorry, your name again?
This is Sadie Quick from the Chicago Tribune.
AD, okay.
Madam President, I wonder if you could talk any more, I know this isn't violence reduction related, but if you could talk any more about the plans to abolish medical debt?
Sure. There are 3 transformative initiatives that we usually talk about in terms of our American Rescue Plan Act resources. Clearly, we talk a lot about violence prevention. The other 3 things we talk about are increased investments in behavioral health services, creating a new Department of Behavioral Health in the Department of Public Health, and ramping up our investments there. Second, of course, is the guaranteed income pilot, the Promise pilot that we announced a couple weeks ago, and the third is medical debt. You know, the principal reason that ordinary working families end up in bankruptcy is they can't pay their medical bills. And so, and the healthcare providers often sell their bad debt to collection agencies for pennies on the dollar. So it's our intention to work with a third-party partner to intervene in that process and pay medical debt for folks, enable them to return to financial stability and improve their credit. So that's the plan. We are at the moment looking for that third-party partner, and when we have found that organization, we'll bring it to the Board of Commissioners for approval.
Anything else on AD?
Yeah, I'm curious if you have any sense of how much medical debt there is burdening patients at Cook County Health.
I can't answer that question, and I'll have to have Nick get back to you. Nick Mathutis, our press secretary.